Hello everyone, welcome back to my channel. My name is Pinky. I'm a clinical pharmacist practitioner. Today I'm going to discuss about a very important topic, and it is chickenpox. Now, chickenpox is caused by a virus known as varicella zoster virus. Okay. Now, chickenpox, it is infectious droplets, and it is like, it's an infectious disease. But when is it infectious? We are going to discuss about that. Now, basically, incubation period, like there's an incubation period range from 10 to 20 days. And after incubation, the symptoms comes in. Okay, when the symptoms comes in, it is called the prodromal stage. In the prodromal stage, what happens is that there is like fever, headache, sore throat. Okay, fever, headache, sore throat. Then this stage, the prodromal stage, lasts for basically 3 days. Okay, now the incubation period, I said it's like 10 to 20 days, and the prodromal stage where you have fever, headache, sore throat, that lasts for around 3 days. After 3 days, what happens? After 3 days, there is like small red lumps. Okay, that small red lumps, it turns into vesicles, blisters, okay, which crossed over 3 to 5 days. And once it crossed over after 3 to 5 days and it starts healing with scab formation. Now, new lesions occurs in crops of 3 to 5 for the first 4 days, and begin on head, neck before moving on to trunk. Now, what medications do we give for chickenpox? Basically, it's paracetamol for fever, pain. Then it's chlorphenamine, which is an antihistamine. It is basically to help with the itchiness. Then it's better to avoid ibuprofen. Remember that it's better to avoid ibuprofen in chickenpox. And this is extremely itchy conditions, can be, yeah, possibly, and secondary infection can be due to scratching and can cause shingles. Now, pain is often felt before rash appears. Okay, now if the patient is more than 14 years, basically we tend to prescribe acyclovir, presenting within 24 hours of appearance of rash. Now, there are other things as well which are used for chickenpox, such as calamine lotion, which ceases to be effective when it dries out. So it is good. It's a good good lotion, calamine lotion, but as soon as it dries out, the effectiveness decreases as well. It's a disadvantage. And sometimes another thing to note down is that sometimes when a child doesn't get chickenpox and the virus remains, hidden, like dormant, and can reactivate and present as shingles at later stage, which is no good. Shingles can be very painful. And pretty much that. And it is infectious. This chickenpox, it is infectious until all lesions have crusted over. And it is infectious 1 to 2 days prior to appearance of rash as well. So these are the things that needs to be taken into account. So if I summarize chickenpox, so chickenpox, it is caused by varicella zoster virus. Okay, and when is it infectious? It is infectious 1 to 2 days prior to appearance of rash, and it is infectious until all lesions have crusted over. And how does it spread from one person to another? Basically by droplet infection, by droplets or vesicular exudates. Now, what is the incubation period time? 10 to 20 days. Incubation, 10 to 20 days. And how long is the prodromal stage? It is 3 days. What happens in those 3 days? Fever, headache, sore throat. Fever, headache, sore throat. And after fever, headache, sore throat, the symptoms appears. That is like, the symptoms are like small red lumps, blisters, vesicles, which crossed over 3 to 5 days and heals with scab formation. Now, new lesions occurs in crops 3 to like crops of 3 to 5 for the first 4 days and begin on head, neck before moving on to trunk. What are the medications usually prescribed? Paracetamol, chlorphenamine. Paracetamol for fever and pain, chlorphenamine for itchiness. And chlorphenamine also helps the patient to sleep a bit better as well. And what should be avoided? Ibuprofen. It's extremely itchy, and secondary infection can occur to scratching and can cause shingles, and pain is often felt before rash appears. Now, more than 14 years, what should be prescribed? Acyclovir within 24 hours of rash. And there is calamine lotion over the counter, which is effective, but its effectiveness ceases when it dries out. Dormant virus, if a patient has got like dormant virus, no chickenpox during childhood, it can turn into shingles at later life. So I have covered everything on chickenpox. If you have any questions, put in the comment section below. I'll try to answer. Thanks for watching and take care. Good night. Bye for now. Bye-bye. Bye.